I have, for the last 3 years, again, because of my own problems, since I was menopausal since I was 38 and have exhibiting a lot of complications and not having any doctors being able to help me out. I didn't want to use synthetic medicines. I found out about the bioequivalent hormone replacement, and thus, for the last 3 or 4 years, I've been using it in my office. The testosterone helps women and men with their enhancing the libido, protecting both their cardio and vascular system. It helps to lower cholesterol. It gives them a feeling of overall well-being. It helps to reduce that central body fat that we start getting as we get older, stronger bones and muscles, depression relief, and clearer thinking. Of course, with men, because they have a prostate, it gives them prostate protection, and it also helps with erectile ability. I have patients that have come here on multiple medications, at minimum 3, most of them 5, especially my women. We call it the menopausal cocktail. A lot of my women come to me on an antidepressant, such as Zoloft, Paxil, whichever one. Then they put them on an anxiolytic like a Valium or Xanax, and then they have trouble sleeping, and they'll be using Ambien or Lunesta or something like that. And usually it really has more to do with hormonal deficiencies or changes in their hormones. So once you start correcting that, I'm able to help them wean themselves off those medications. This is not cookie cutter. I mean, in order for you to be able to get a bioidentical hormone replacement, you need to know what your blood levels are. This isn't just something that you come in and you say, I want hormones, and we give them to you. We have to do blood work. We need to see what your levels actually are, and based on your levels and based on your symptoms, then we formulate the milligrams that you need of each and which ones you need.
I had a near-death experience where I had a disease, and I had a condition called ulcerative colitis, and I've recovered from that. I have some underlying issues from it, such as premature aging, anxiety attacks, depression, and I no longer had a sex drive. It was hard to believe that hormone therapy was going to solve that problem for me, because it was just very intense and I had been given no hope. And after seeing about 3 gynecologists and coming in here one day in just a frenzy, Dr. Mercedes says, there is an option for you. So she did some blood work on me, and come to find out, I had less testosterone than a 65-year-old woman. After the therapy, she tells you in the sequence of events that things are going to start happening. First, she said that my panic attacks would ease off. And in the back of my mind, I'm saying there's just no way. Had them for too long, they're too intense. After 3 weeks, already, none. And that was a real big deal, and that's not a joke. Everything was just there. No panic attacks, clear mental clarity, and sexual function was back.
Well, one of the things that people always ask, because they don't want to be taking the synthetics, they've heard about the problems, or they've been on the synthetics and their doctors have taken them off of it. So these, the pellets that we use here are completely natural. They're derived from the soy plant. There's no excess capsules. There's nothing extra. It goes into your buttocks on the side, on your hip area, and it stays in your body in women for about 4 months, in men for about 6 months. And there's no capsules to take away, nothing. All of the medicine just dissolves in your body. There's some generalized complaints that people have that they don't really realize that it might be hormonal, and that's when I'll encourage patients to have them look at. I mean, simple things like difficulty sleeping for women, palpitations, a lot of bone and joint pains. A big one is, loss of libido. A lot of people have been told that is natural, that your sex drive declines with age and that we should just be conformed with it. And that's just not the way that it should be. We should be able to have a nice, active sex life.
I don't think there is many doctors here in this area who are even doing the hormones, which is unfortunate. She took the time out of already running a practice to go back and to continue her education to be able to do it to help others. Go to drmercedes@westchase.com. That's what I tell everybody. Go to her website. There's a great article on there about it. Read about it. Call her, make the appointment,